Good morning. Thank you, Stacey, for giving me the opportunity again to speak on your platform and for this podcast. I'm really grateful to yourself and Siri as individuals, and also to your organization, the CF Research Institute, for coming to us to highlight our cause globally. And it means a lot to us. And we look forward to keep in touch in the future and work together. And this is our third meeting that we're doing and final meeting so far. And in our very first meeting, what we did was I discussed how I got involved with the CF families in Pakistan. And in the second podcast, about a month ago, I went through what I have achieved, although it may not sound a lot, but I think it's been quite a lot. And this particular podcast is about where we need to go from now and what is out there that at least I've got in my mind to achieve. And hopefully we will achieve it with the passage of time. So one most important thing that I think we need to carry on from now is have that link with the families, the CF families in Pakistan, CF professionals who have been very helpful to me and supported me all the way along in various cities across many platforms to bring about some of the changes. And that changes obviously includes awareness, which your organization also has highlighted to the rest of the world globally as well. So I'm very grateful to all those my colleagues. And like what I was saying, last time, what we achieved, and I said that the Lahore Children's Hospital have now set up regular monthly CF clinics, and they have ad hoc weekly clinics. So if somebody is unwell, they can contact and go on a weekly basis in those clinics as well. And online WhatsApp advice is available to everybody still. So that was one ongoing issue, ongoing activity. And since our last podcast, we have another city, Faisalabad, which I did highlight in my last time that they are likely to take up the challenge and start the multidisciplinary CFT meetings and clinics. And I'm glad they have done that. And it was really nice because they had a local person who came, who took the picture, televised, and I think he's going to put it on YouTube, and I'll share the links once they're available. But it was really nice that I'm still in the UK, but they themselves and the patients, they got together, they made the effort, and they got a clinic which ran beautifully. It was supported by my colleague, Dr. Zubair from Saudi Arabia. She was during school holidays visiting Pakistan, and she was another key person in that clinic, and it made it possible. And it was really, really great. And now I'm just waiting for them to say when they're going to do the next clinic. So it is there, it's getting there. And I've also heard a little news from Karachi that they may be willing to start something towards the end of November or beginning of December. So these are three main cities we got. And I think it is down to raise awareness through yourselves, through our other networking. And that networking has to carry on amongst all our colleagues, the patients, and international community. And we are available on WhatsApp, on YouTube, and whenever I have the conferences, like I said, the ad hoc conferences at our clinics. So those are the links which I will love to maintain for the future as well. Now, having established those multidisciplinary CF clinics in some cities, obviously we do want to expand, and this is sort of the next expansion I'm hoping is going to be in Karachi. And Karachi is one of the largest cities in Pakistan with the largest number of CF patients that I know. And I think that would be a really great step in the right direction for the families with CF. And I'm grateful to all my colleagues in Karachi who are working on that, and all the CF families who are working together as well to make that happen and make that possible. So I'll give you more news at another time in that, but yes, look out for that. Along the ways that what we need to do is, I did mention last time that we are getting some of the diagnostic facilities. but I think these are still difficult for a lot of patients. And we need to work with the laboratories and other research institutes on genetics, etc., sweat tests, fecal elastase, at what I call more affordable economical prices, because all healthcare in Pakistan is paid for by the families and patients. So, for example, one of the research, genetic research institute in Pakistan at the moment, we're working on it, they can provide that at a fraction of the cost that currently happens in the UK or United States. I think if somebody was sending the samples to United States, it costs about $250. That's how much they're charging, and which is a huge amount of money for the Pakistani families. And what they're trying to do is they massively do it for $3 to $5. So this is how much difference it makes. And obviously, we need to work together with them. And I'm very grateful to those individuals, Dr. Amima in Aga Khan Hospital in Karachi, and Dr. Usman Ghani, and the researcher Anam Safdar, who are working on those things. So I'm very grateful, and I hope we can extend their services to the other cities as well, and to more patients as well. So I think that diagnostic facilities need to be readily available at affordable prices for us to make diagnosis, because cystic fibrosis, as we know, it involves the gastrointestinal system, malabsorption, failure to thrive, as well as the respiratory diseases. And these two things individually happen in Pakistan quite a lot, in a developing country, undernourished children, etc. So they get that. So it is highlighting that one, which what we've been doing so far, making it apparent to everybody. Look, these are the differential diagnoses of these conditions, look into it. And then once they clinically start thinking about it, then it is obviously next step is to confirm those. And for confirmation, we need some of those tests which are easily, readily available at economical prices. So we will definitely carry on working with that. Now, getting some people now aboard is excellent, but what I have in plan is that we need our senior colleagues to take this further, to encourage their junior trainees to take up more training in pediatric respiratory medicine. And not only that, with cystic fibrosis as well. So I would be asking my senior colleagues in Pakistan to encourage their local trainees to take more interest in the respiratory and cystic fibrosis thing, and ultimately make it as part of the specialist training as a part of their respiratory modules, for example, in Pakistan, and also to include in their undergraduate curriculum, because that is where it starts. So the students need to be thinking about it. And for example, if anybody who was doing postgraduate exams, which I'm a senior examiner for Royal College of Pediatrics and Child Health in the UK, if there is somebody who's failing to thrive chest fraction, you say, what are the causes? CF will be right on the top. That doesn't happen in Pakistan. And I think, although it is changed to some extent, we did a mock exam in last December, about 18 months ago. And some of those candidates who were coming through for mock exam, when they came across these sort of clinical scenarios, they were saying cystic fibrosis as one of the causes. So this is what I need to bring about. This one to see in everybody, all the undergraduates going through their curriculum, postgraduates specializing in these things and thinking, yes, there is a condition called cystic fibrosis and we need to be thinking about it. So that is a major change that I would like to happen. Now, after having made the diagnosis, obviously, and having the clinics, the other big issue is about the availability of the medications for these patients. And this is where we need our local Pakistani pharmaceutical agencies. At the present, for example, in Pakistan, there's only 3% hypertonic saline available for nebulization, which people sometimes use for other conditions other than cystic fibrosis, for example, bronchiolitis or other phlegmy conditions. But 5%, 6%, 7% are not commercially available, and they are made locally of different strengths or a different quality. There's no standardization, and it's difficult for people to get it, and they need to get, because they make it in a bottle, it runs out after it expires very quickly as well. So we have spoken to a couple of pharmaceutical agencies, their representatives, and said, oh, we may be able to make 6%, 7% as a commercial product. And that may be something really, really nice. But obviously, it's not just the hypertonic saline, it's the pulmozyme as well, the DNAs, for example, it's the nebulized antibiotics, which we don't have, it's the Creon, which we don't have the modulator treatments, etc. And it's one, not having the medication. Secondly, they're expensive, and thirdly, there's some sort of prevention in importing those medicines at the governmental levels. So we need to talk to health authorities as well to ease their sanctions on some of these products, which are basically what I call life-saving for some of our patients. For example, enzymes, digestive enzymes, they're essential for them. They need to eat 2 or 3 times minimum in a day, if not more, and they need that for absorption of their food. So one needs to coordinate services and encourage them to help all these patients. And I think the patient advocacy is important thing, just like your organization, you're doing it. I am in a process of talking to people, and this clinic in, for example, Faisalabad, and now what's going to happen in Karachi. I've let the families talk to the doctors, request them, you take up your matter. I can do certain things, I can push them, but I want you to take it forward so that they can hear your voices better than what I tell them as an outsider in there. And I think is that talking about patient advocacy, there is a huge, great need for a local, national, Pakistani CF body, whether we call it CF Society, CF Trust, CF Foundation, or whatever. There is a great need, because then we can coordinate our future needs and services, medications through that. And I think that will be a great day that once we can stand up and say, now we have Pakistan CF Cystic Fibrosis Foundation, Trust, Society, whatever. And that is one of the main aims that I'm working towards, hopefully. And through that is overviewing the patient's interests, representing the patients, patient advocacy, and standardizing and making their care available to everybody. So here at the moment, yes, we got individuals interested, but they're not CF trained. So through that, it may be that they can actually have local standards of care for these patients as an outpatient care, sputum cultures that they send, laboratories, what they need to look up, what sensitivities need to set up. And when they get inpatients, like for example, in some of the local hospitals in Pakistan, you have 3 children per bed because the occupancy rate is so high. But we, as you know, in the West, we want sort of cubicles, individual cubicles, and sealed cubicles. So they got our own bathroom in there as well. And there's no other CF person on that ward to avoid mixing of these, or possible mixing of the patient and transmission of the bugs from one to the other. That doesn't happen. So those are sort of things that the organization, Pakistan CF Trust or Foundation, could lead and guide people as well. And also, it'll be very important through that body have data collection, because we yet don't know in Pakistan how many patients there are, what genotypes they have. Yes, some of those patients who are having their genotype testing, we know that, but we don't know nationally how many people there are, what their genotypes are, what medications are important for them as a specific mutation, specific treatments, etc., and what their outcomes is and how we need to take it forward. But if there was a body, then certainly we can get that done as part of the organization as well. And also with that, there'll be research opportunities for individual centers within Pakistan to look at the outcome of these. What ages do they present in Pakistan? What are the difficulties people are finding in delay of the diagnosis? What is delaying the diagnosis? I know we mentioned some of the awareness, etc., and undergraduate curriculum, postgraduate training and all that. What is it that people are thinking about, when everybody's coming with the full weight gain and cough? Are they just thinking it's a TB, which could, it could be the case. But it's getting those things. So get the research looking into the causes and education of the families for the future.
we got, at the moment, we got families with 2 or 3 children, and they don't even know that this was one of the genetic disease, that if one child was affected, there's possibility other children or the pregnancy has been affected. And I think this is raising that awareness, having the tests available to them, should they want to consider antenatal diagnosis type things, then those things can be made possible through an organization such as Pakistan Cystic Fibrosis Foundation. And I think, like we are talking now, they are, or they can then be, part of the wider global international CF community. And I think that is where we can then all work together as a global people, make the care and standards available to all our CF families across the world. Nobody's left behind. Nobody can say, I can't afford it. We are all there to look after all the families, and not just one who can afford and let the others die in poor countries, which is harsh word to use, but unfortunately is what is happening. And I think this is what we want to do. We want to improve the care of these patients, of these families in developing countries where they can't afford the treatment, but working, networking, supporting each other in all ways we can. We maybe from Pakistan can provide lots of clinical material for researchers in the West, for example, and vice versa. We may need more economical or therapeutic help from the West imported into Pakistan, but I think we all need to work together. And these are some of the thoughts in my mind that we really need to work on for the future. And it'll be a great pleasure to perhaps meet you another time to discuss of what proportion of this I've actually been able to achieve and what's left behind. But it'll be a great pleasure to keep in touch. As I say, we need international links. We need to carry on working for our families, our CF families. And it's been a pleasure. I won't take too much of the time now, but I would certainly definitely appreciate an opportunity in the future to talk through your organization, through yourselves, to see where we are, where we started, and where we got in maybe a year's time, 2 years' time. So thank you again, Stacey, to yourself, to Siri, to CF Research Institute for giving us your time, giving us your support, and we look forward to working together in the future also.